Hello, everyone, and welcome to the Eris Foundation Facebook and Instagram Live series. I am Melissa Berry. I'm the founder of CancerFashionista.com. I help women look and feel their best throughout their cancer journey and beyond. And I am over the moon, so excited to have such a special guest with me. She's also a really dear friend of mine, Ricki Fairley, and she's joining me to discuss Black breast cancer facts. So first, with much pride, I'm going to read Ricki's amazing biography here. Ricki Fairley, welcome, Ricki.
I love you, Melissa. Thanks. I'm so happy to be here.
I love you. I'm so happy you're here. Ricki Fairley is a stage 3A triple negative breast cancer survivor whose personal purpose, passion, mission, ministry, and blessing are to raise awareness, fundraise for a cure for breast cancer, and support and coach what she calls her breasty sisters through their breast cancer experiences. Ricki also has founded most recently Touch, which we're going to learn more about tonight, and the Black Breast Cancer Alliance to address Black breast cancer as a unique and special disease state with the overall goal of reducing the mortality rate for Black women. So, oh my God, we have a lot to dive into. But first, I would love to chat about how we met. And it's funny because when we were talking today, I was like, wait, it's been a long time. And refresh my memory on that, but tell us.
Well, we probably couldn't remember because we had chemo brain.
Yes.
But Melissa, we met doing a crazy video called What's Your Bra Size? Remember, we were in Grant Park in New York, and we were there with another triple negative breastie who actually died about a month after we made the video. Remember that?
God, I'll never forget that. Oh my God.
That we were around someone who had the disease that we had that died, right? So it was really a horrible situation, but it was, we met this crazy video and there are a bunch of real actors, and I guess there were 3 survivors in the video talking about what's your bra size? Well, our bra size is triple negative, to kind of bring awareness to our disease.
Exactly. Yeah. And then we've just been friends ever since. And Ricki and I are known to be the first ones to hit the dance floor at most breast cancer conventions. Right. So if you would like some party starters, you can contact us. But all kidding aside, thank you again for being here with me and for this very important conversation. So I've got a list of questions here, and I hope we can get through all of them. And just thank you again for joining us and working with us tonight.
I'm so happy to be here. And I'm going to take Harper's barking.
Oh, you want to take a quick break?
Can you hear her?
Of course not now. I can't. But maybe it's when I talk, she likes to bark.
I couldn't hear her before, right? You couldn't hear her?
I did. Oh, now I hear her now.
I'm going to go get her. Is that going to screw us up? We have to edit this out.
We could either edit out, or we'll see how I am under pressure, just chatting with all of you. Again, so excited to be speaking with Ricki tonight. I've been looking forward to this all day. She's a superstar, and also one thing the 2 of us have in common is triple negative breast cancer, and we're also really active with that wonderful organization as well. So it's actually been a while since I've seen Ricki. So when I heard that she was going to be a guest, I was super excited. So thank you, all of you, again for joining us. And Ricki is here in her adorable dress. Now we got to see it, the whole dress. I'm glad the dog barked because now we got to see the whole outfit.
Oh, it's so funny. Well, yeah, who gets dressed these days, right? I usually have my booty shorts. But Melissa, when we met, I think it was the first time either one of us had met somebody with triple negative. And so I think we bonded because I think I had just finished treatment, and I think you were still in treatment.
Yep.
And we've never really been around anybody with our disease. And so it was great to come together with someone that had what I had.
Exactly. Because there are so many different types of breast cancers. Right. And I'm like, who else? I didn't know anyone else had triple negative. It was, so when I met you, it was love at first sight. And we've just been.
Yeah, I love it.
So thank you again. We're going to dive in. So we've spoken a lot, and obviously, so the numbers that you've provided to me and the Eris Foundation, sort of, to prep for this conversation, honestly, are staggering. And I don't know how else to say it. Shocking. Can you tell our listeners some statistics on Black breast cancer?
Yeah. So I really believe, and I've come to believe after 8 years doing this, is Black breast cancer is a different disease, just like triple negative is, and why it's different and how it's different is that Black women die at a 42% higher rate than white women.
Why is that?
Yeah.
What is the
There's a
reason?
lot of reasons, and there's another bad one too. So Black women under the age of 35 get breast cancer at twice the rate and die at 3 times the rate of white women.
Unacceptable.
Another bad one too is that Black women get recurrences at 39%. So 39%
Wow.
their breast cancer recurs. So why is that? We don't know. So there are a lot of kind of psychosocial factors like quality of care, going to community hospitals, lack of health insurance, even emotional factors like not dealing with a tumor and having it for a year or 6 months or something before you go to the doctor because you're going to, pray it away, or not wanting to admit that you're sick. Not being able to take care of yourself because you've got 3 kids at home and you're the breadwinner and you've got to, take care of your children. So you give priority there instead of going to take care of yourself and a bunch of stuff. But at the end of the day, I really believe that our physiology is different. Like I had triple negative. I don't have BRCA. And we know like even
Right.
it's very associated with BRCA, the gene, and I don't have the gene. And I've had all the gene testing and my Black doctor believes that there may be a Black gene that we haven't even identified yet.
Wow.
But Black women are only don't participate in clinical trials. Our representation is about 3%. Think about it. The drugs that we're making now, or pharma is making, they've only been tested with like a handful of Black women. So we don't know if they work, and they don't work. And I mean, I'm a blessing. I shouldn't be here. We know I shouldn't be
Ricki.
here.
Oh my gosh. Don't even say that. Oh my gosh.
But the odds of me not are high that I shouldn't be here. And I know that I'm here to do this work, that God left me here to do this work. But most women that had what I had, didn't make it. So I feel very blessed to, be able to be an advocate and speak on our behalf and speak on behalf of my metastatic sisters with TNBC. But it's just a devastating disease. So I think that what I'm trying to do, and with my new foundation, Touch the Black Breast Cancer Alliance.
Let's tell us a little bit about Touch. And thank you for sharing those statistics. I mean, it's really hard to hear, but we need to understand this more. And I think, just to wrap our heads around these statistics and to sort of see what we can all do collectively to change those numbers.
Yeah. So I think we need to do some work on our physiology. Like, I don't think I'm trying to bring the science to it. And if you think about it, and I've challenged pharma with this, 20 years ago, the AIDS advocates went after pharmaceutical companies and said, people are dying, can you fix it? And they attacked it, and they went to work and they found drugs. And guess what? You don't die of AIDS anymore. People live for years. Magic Johnson is still alive. So I'm really trying to get pharma to bring the science and the resources to dealing with Black breast cancer, figuring out what's different about our bodies, what's different about our response to the drugs, and what drugs do we need to be taking to make ourselves well. So I'm trying to do a lot of work around that. But a lot of it is that because we don't participate in clinical trials, we don't have the research. We don't have the data. And so in order to get the physiology understood, I need to bring more Black women into research. And it's a really big challenge because they're afraid, they're very fearful. There's a lot of, history with the syphilis study and Henrietta Lacks. And actually one thing I hear even more so is I'm going to get the placebo drug. So they don't understand how a trial works because there is no placebo drug. You get standard care, but they don't understand that. So trying to educate about that, but also convince them that it's okay to put yourself into this vulnerable position so people can learn about your disease. And it's really hard because, I'm a control freak. I mean, you're a helicopter mom. We are. That's something we're helicopter moms. But Black women are control freaks. And there's so many things about our lives that we can't control.
Right.
We put in a situation where we're totally vulnerable, and we're often in a situation where nobody in the room looks like us, and they want to stick a needle in your arm about a drug they don't know anything about. I don't think so. So how do we work towards making that situation better? How do we talk about it and message? I'm a marketing person, so it's always about.
Oh my, that's why we get along so well.
Yeah. So what head now, and what do we want to put in their head, and how do we want them to behave? And so I'm trying to do that work. What do we need to communicate to make these women feel better and actually feel empowered, feel powerful about being in a trial situation so that we can learn more, we can help.
Right. So we can all take the control back.
Take the control back and be in control to do the work that needs to be done.
Exactly. And to make, and to move, and to be able to have progress.
Right.
And see, research that's working and get the results and get the solution that we need to change these numbers.
Right. Like I would love to have the bottle say, this drug works for Black women. You know how drugs say, what the indications are? So that's what we need. We need the right medications. We need the right therapies. But I mean, even one other statistic, Melissa, is 77.3% of Black moms are single. Think about that. 77.3% of Black moms are single. So add breast cancer to that number. What do you get?
Wow.
Are you going to go to work and feed your kids, or are you going to go get your mammogram? Are you going to take care of
nobody should have to make that choice.
Right. So we're making these choices because so many of us are the breadwinners for our families. We're taking care of our kids, our parents. We live in this matriarch of helping other women in our circles. And so we're really busy. I mean, when I had breast cancer, I'm like, what do you mean I don't have time for this. I have stuff to do. I got to work.
Exactly. It can be very inconvenient.
Very inconvenient. And so we don't have the luxury of like, okay, I guess I can take 6 months off and go to chemo, so.
Right. Exactly.
Choices that may not be choosing life. I think we were very blessed, you and I, to be able to make the choices to choose life.
Exactly.
Resources and family and support. A lot of women don't, and so I'm trying to provide that kind of help for women and create this
incredible
sisterhood of breasties so that people can depend on me. And
absolutely,
not a day goes by, not one day goes by where I don't have some phone call. My mother just got diagnosed. My sister just got diagnosed. My daughter just got diagnosed. Can you help them? We don't know what to do.
Well, especially now that you've found a touch, I'm sure that you're on the ground working with women more than you ever have.
Yep. I have my little phone. I wear it around my neck. See my strap? I wear it on my neck every day. So.
Oh my gosh.
It's like I'm afraid to put the phone down, and I know I have to talk to them because I know that's my purpose. You're
amazing, seriously. And like I've always called you like a big sister, and now you're a big sister to even more, and helping so many more women. And we're just so happy that on behalf of the Eris Foundation that you're speaking with us tonight, because our mission is to really reach as many women as possible, no matter what race, what there's if you have breast cancer or that's it. So tell us a little bit more about what you're doing with Touch, as far as what is your dream, and what are some of your goals? And this really folds into a question I had, which is, what actions do you feel that you can take as an individual along with your organization to make a difference? Like, what are some of your dreams and goals for the organization and for, eradicating breast cancer among Black women?
Yeah, that's my vision, is to eradicate Black breast cancer. But our space, the breast cancer advocacy place, we have more advocacy groups than any other disease. I think it's because it's women. We all want to get shit done. Right. So not every day, I think all of us in this space working can go to bed and pat ourselves on the back and say, I did something really good today. I helped somebody get to chemo. I gave a hug. I got them medication. I cooked somebody dinner. I did the right thing. I got the drugs made, or whatever, in all of our jobs. But at the end of the day, Black women are still dying. And so more needs to be done. More work, different work needs to be done. One of my favorite quotes is Albert Einstein, a problem cannot be solved within which the framework it was created.
Wow.
And he also said insanity is doing the same thing over and over again and getting the same result, right? So the work that we're doing and the science that we're working on isn't working. So we have to do it differently. So I'm really challenging pharmaceutical companies to flip it over, turn it upside down, throw the lab up in the air, whatever, figure it out, but do it differently, because what you're doing hasn't worked yet. And we need to figure out how to make it work. So I'm doing a lot of work with pharmaceutical companies, and they are so welcoming of me. And
wow, that's incredible.
And hearing, and we don't have an answer, but the scientists want to do the right thing. They want to get rid of breast cancer. They're all working really hard in their labs to do the right thing. So they just need encouragement. And so I try to do that, like, help me, help you. What do you need from me?
Right. No, thank goodness for what you're doing. You're really rallying the troops, and what I think what's great about what you're doing is you're looking to find a solution, but you're also supporting women that are reaching out to you that desperately are looking for that. And so what kind of support do you offer them?
So really just hugs, and try to find them resources. I mean, a lot of times, especially with young Black women, they will go to the doctor and present with a lump, and they'll be dismissed. You're too young, and waiting for 40 for a mammogram is way too late for Black women. Okay, we should get a risk assessment at age 25. I think as soon as Black women go through puberty, they should be checking their breasts because it's just the numbers are just too devastating. So like just helping them understand, that they can stand up for themselves. That you can.
Is there an age that that's more common for Black women to have breast cancer? Is it young? Would you say they skew younger?
Well, the numbers are, under 35, we get at twice the rate. So overall, we're on incidence, but the mortality rate is 42% higher. For women under 35, it's 3 times the rate, the mortality rate. So
you're dealing with a lot of younger women, like you said, also single moms, right?
And we're also getting it at later stages because we're too busy to go to the doctor, or we got to take the kids to school, do the work, whatever, and we don't take it seriously. And then when we go to the doctor, it's stage 3 or metastatic, and so the numbers for metastatic are really high, that we are diagnosed with metastatic breast cancer like crazy. And so it's really just understanding it. The Ad Council did some research a couple of years ago, and they identified that 92% of Black women know about breast cancer. They're aware, they talk about it, whatever. About 27% talk about it.
Wow.
Friends. So 92 to 27. Guess how many act on it? 17%.
Why do you think that is?
Because we don't talk about it. We don't talk about it. We wait till, oh yeah, Grandma Edith had that. Oh yeah, don't tell the neighbors you have breast cancer. We don't talk about it. It's like a hush hush thing. I'm not sure why that didn't happen in my family, but still, it all comes out when somebody gets sick.
Right.
But we don't really talk about any health, Oh, the sugar. She's got the sugar. She's got diabetes or her high blood pressure, or just high blood pressure. So we don't really talk about.
Right. Like there's a certain sense of shame associated with it.
Yes, it's weakness. It's a weakness. So we don't talk about it until it becomes a huge problem. So even just putting the conversation on the table is so important to bring it out and let people feel comfortable talking about it. So I try to develop platforms for that. Like I'm actually working with Haley with the Triple Negative Breast Cancer Foundation, which we're both on the board.
Yeah.
Working on our Pink Table Talk program. Have you heard of it?
Yeah. Well, you can feel free to share, but it sounds awesome.
Yeah, so we're actually doing a program. We have the first one scheduled for October 11th, and we're gonna have Valerie and her family be our family, and we're gonna basically sit down with Valerie and her sister, one of our breasties, and her daughter, and talk about genetics and genomics and biomarkers and how to talk to your family and sort of put all that family, her story on the table. Like, what is her story? What is that, what's going on in your family? And
that's wonderful. And that will help perpetuate, I think, and open up conversations among other families, right? Isn't that sort of the purpose?
Yeah. I actually just I talked to, believe it or not, Matthew Knowles the other day, Beyonce's dad. So he's actually going to do one of our Pink Table Talks.
Oh, awesome. Really?
So, because male breast cancer, Black men get breast cancer at 50% higher rate.
And 50% higher. Wow.
And die at a 60% higher rate.
Wow. So let's talk a little bit about how can all of us band together to make a change? Like, what can we do collectively to help us make a shift here?
Yeah, and that's part of I never really got to finish talking about my mission.
Yeah, please.
We're all working really hard, and we all can feel good about our work, but it's not enough. So I don't think one person, one pharma company, one scientist, one advocacy group can get the work done, right? We all have to do it together. So I'm trying to build an alliance, a group of allies, of which you're one of them, and heirs to it. But we're all working together, marching towards our odds where there's no breast cancer, no Black breast cancer, no breast cancer. So I want to try to build this force of nature, this fierce force of nature of people and organizations and breasties and scientists to work collaboratively where we can hold ourselves accountable to get this work done and rely on each other and each other's strengths. Like I had a call earlier today on a research project that I want to field to sort of understand the psyche of Black women, just to help with the messaging. And guess who's doing it with me?
Who?
Komen and breastcancer.org.
Wow, that's awesome.
And Haley and Triple Negative. So when we were talking to a drug company today, and they couldn't believe that we were all in the same sandbox. Breastcancer.org and Komen haven't worked together in 20 years.
Wow, that's amazing.
My little foundation, but they understand the importance of the work, and they know that with all the work they're doing, and they're doing great work, then we need more, and we need another voice. And so they're open and willing to do that. So I want everybody to be my ally, and I have a page on my website, Allyships.
Ooh.
You see that, and I'm putting your logo on it, but Allyships, because I want to work together. So you want to hear my scathingly brilliant idea from last week? So
of course I do.
So on Black Friday, right? Normally we'd be shopping. I'd be in Nordstrom's, you'd be in Bloomingdale's, right?
Yeah.
But we can't shop. We can't go to a mall. Who's gonna go? What breast is gonna go to a mall, right? Who's gonna go stand in line at Walmart at 4 a.m. to get the cheap TV? We're not. So we're going to do a Black Friday takeover and make it Breasty Friday.
Ooh, I love it.
Do like a virtual walk that Friday morning. We'll probably do it about 11 so the West Coast can wake up.
Wow, that's so cool.
And do a virtual walk and walk in your house with your family, whatever. But I want every breast cancer organization, really anybody, any organization, to sign up and walk with us. And
beautiful. Alliance. I love that you're really pulling everything because you're right. Like there's all these wonderful organizations that have a common mission, but now we really need to pull it all together,
right?
To eradicate Black women.
So we have to work together, and so I want everybody to be in the battle with me, and I want us all to be in one accord, because if the scientists at one drug company talk to the scientists at another drug company, they may come up with something. And so I'm hoping that the research that I'm doing to understand how we think and how we think differently will help all of the drug companies get to that place of where they know how to do the research, because they all need to recruit better for clinical trials. They're all looking to do that. And the one really good thing about COVID is that the health disparities that I've lived with my whole life and my family the whole life, are now on the table, and people are addressing it, and it's a good thing. It's a good time.
Oh, wonderful. Oh my gosh. Well, I can't wait to see what you're going to do next. This is amazing. Amazing. The work that you're doing.
You can help me design the t-shirt for the walk. Okay. I need some like a fashion statement.
Oh, I mean, look who you're talking to. Absolutely. I'd be so excited to do that. Let's see. We have been working as let's see. Is there we've covered so much as far as statistics and what we're doing. What would you say would be the one, if you could share one message about, Black women and breast cancer, what would it be?
You know what I'm going to say, Melissa? Your peace is non-negotiable. That I really do believe that my breast cancer was caused by stress. And, I changed everything about my life. I really got rid of all the cancer in my life.
The goosebumps. You really think so, huh?
I do. And I had to go through and figure out what things would make me choose life and make a lot of decisions about people, things, work, whatever, to choose life and find my peace. You know what I mean? And I think that I had to recognize that there were other cancers in my life that I had to get rid of. I make jokes about my husband, and I have a
don't glaze over that one. This is one of my favorite Ricki words. Can you explain about the husband?
I was married for 30 years, but I was the breadwinner for my family, and I really, let's stay together for my kids and stuff. But when I got sick, I realized I could no longer take care of a grown man. I could take care of my children. Haley was still in college, but it was not a good thing in my life. It had to go. I got rid of my business partners. I sold my big house in the suburbs, and I moved to the beach. But I did all that on chemo. Wasn't really, I wouldn't recommend that timing.
You did that all when you were going through chemo?
Yeah, I did. Crazy.
You cleaned the house when you were going, oh my God.
But I had a lot of help from my friends and my family and stuff, but I knew that I had to choose life. I knew I had to do something different. because it was killing me. And I knew, and I had to learn that, I had to learn for myself that I was enabling people to be dependent on me. You know how we are. I got this. I'll take care of it. I got you. What do you need? I'll take care of it for you. And that's what we do as mothers. And definitely, we are the superwomen of the world, right? And so I was taking care of everybody. I felt like an octopus that was pulling on all of my arms, and I just couldn't breathe. And I had to realize I was causing that. I was causing those dependencies. I was allowing that to happen.
Wow.
So all of a sudden, okay, everybody's got to go. And Mary was like, what's wrong with her? Is that chemo brain? Like, what is that? Is that because she's bald? But
no, there is a, we all understand it. The survivors, the thrivers, whatever you want to call us, there is something that goes off that's like you want to, because it's, I guess in a sense, you have a new lease on life. So you want to clean house in a way. And like you say, get rid of anything that's toxic, whether it's a relationship or the stuff in your home, like whatever it is, it's kind of a time to reassess, isn't it?
Right. We become badasses. But, when somebody tells you you're going to die, you become a badass because you didn't die. So it changes your whole perspective. And, I think it made me stronger. And, I don't want to say that breast cancer was a good thing, but in a lot of ways it was a blessing that made me do things in my life. And I had to learn that my peace is non-negotiable. And I
love that. My peace is non-negotiable.
I can hang up the phone, walk out of the room, so you gotta go. I gotta love you, bye, I gotta go. And I will find my peace. And I do it every morning on my paddleboard on the water. But
that's what you guys. If I don't know if we have any paddleboarders out there, but Ricki's amazing. You should follow her on Instagram. She's always on that paddleboard. And I still, how many times did I say I'm gonna come? And then
you gotta come to my beach. It's beautiful. I know I was out there this morning. I was out there actually, and I was talking to Bella on FaceTime because she wanted to see the ducks. My 3-year-old granddaughter. So she paddleboard and said, well, I can find ducks for her.
Oh, that's sweet.
For the ducks.
I still can't believe you're a grandma. I don't even know how that's possible.
No, I'm also the third one. So, but yeah, you have to find your peace. You have to find your peace. And one of my favorite lines from one of my yogi mantras is, I seek order, simplicity, and peace, waiting for my blessings to increase.
Beautiful.
So
I love all of this, really. You're amazing, and I'm just so glad that we had the chance to talk about such an important topic. And I hope that everyone out there, learned something, and then we'll share this with others. And this won't be the last time that we have this discussion. I hope that we do this again, and
we're gonna fix it. We're gonna fix it. And
we're gonna fix it.
Follow me on Twitter. I'll remind you every month to check the breasts that you love. I know you have a pair.
What is your Twitter handle?
At Ricki Dove, RICKIDOVE, like the bird, or at Touch BBCA. And all of my social media for my foundation is at Touch BBCA on Facebook, Instagram, YouTube, and Twitter.
Fantastic. Well, I seriously cannot thank you enough. And just sort of to recap, women more than ever before need support with reconstructive surgery after a mastectomy. And for any of you guys that are just tuning in, the Heiress Foundation is incredible. I'm always bragging about it. They help to raise money for women who cannot afford breast reconstruction. This is a real thing. There are women that cannot afford it, and they help them afford it.
And we didn't talk about that. Black women are less likely to get reconstructive surgery because they can't afford it. They may live in a rural area where there are not a lot of plastic surgeons, but often it is a price and it is a cost issue for them. So
again, not acceptable. And thank you for weighing in there, because something I was just talking to the Heiress Foundation about is that, their intention is to help everybody, no exceptions, all shapes and sizes. And, if you would like to make a donation, you can go to the Heiress Foundation website. And also, if you would like to apply for a grant, even if you have health insurance, you're still eligible for a grant. So if you know somebody that can use this, please do it. And one thing I love to share is when I first I was on a panel for the Heiress Foundation in New York like a year or so ago, and I posted about it on Instagram, sharing what I was doing. And a woman who I never met in my life, and who lives in Texas, Debbie, she reached out to me on Instagram and said, "Thanks to you for teaching me that the Heiress Foundation even existed. I applied for a grant and I'm able to have my reconstruction." And that's when I was like, whoa.
Oh, it's beautiful.
Yeah. So I'm so glad that you're part of the family now. And
I dance with you on Instagram every day, Melissa, you know.
What's that?
I dance with you every day on Instagram.
Ooh, I know. COVID's made me a little. I mean, I may have gone over the.
No, there's no edge. You're a badass freshie. No
Thank you so much. So yeah, definitely check back on Facebook for details for our upcoming live events. And you know, I said before, we can go on and talk about this stuff. It's so important, and you know, we have your back, and we're going to continue this conversation because, you know, I feel like we're just scratching the surface here. So thank you again, Ricki, for joining us.
Thank you so much. Breasty love.
Breasty love.